Now coming towards this posterior cerebral infarct. So the vascular territories over here, the pica, the anatomical location, stroke syndrome, and the clinical finding that you are going to see. In pica, posterior inferior cerebral artery, and the anatomical location, inferior posterior cerebral or hemisphere, inferior bumps in the lateral medulla, and the stroke syndrome that results from pica. Stroke is from pica ischemia at the lateral medullary or the Wallenberg syndrome, and superior cerebral artery syndrome also. So the same names. So coming towards the finding, which include vertigo, nausea, vomiting, ipsilateral facial numbness, Horner syndrome, dysphagia, and ataxia, and the superior cerebellar artery ischemia leading to superior cerebellar artery syndrome. The anatomical location, the dorsolateral upper brainstem and cerebellum and superior cerebellar peduncle. The clinical finding include ipsilateral ataxia, vertigo, nystagmus, and dysarthria. In eye anterior cerebellar artery, there is the lateral pontine syndrome with ipsilateral ataxia, hearing loss, Horner syndrome, contralateral decreased temperature, and pinprick. And these are, then come the top mid basilar, the proximal basilar, and the vertebral artery syndromes. I think that you should also pause this slide or snapshot it and read it yourself as well. So I will tell you about this proximal basilar stroke, that is the locked-in syndrome, where there is quadriplegia, horizontal gaze paralysis, bifacial paralysis, and may have preservation of the vertical eye movement. And the vertebral artery ischemia, you have the medial medullary Dajorin syndrome with contralateral arm and leg weakness and ipsilateral trunk paralysis. And if you, I really wish to tell you when I'm just telling you about these arteries, that this is the trigeminal neuralgia that we come across quite frequently in practice. So the vessel that most often cause the trigeminal neuralgia is either superior cerebellar artery or and other non-offending vessels that include the AICA, the anterior inferior cerebellar artery, and the vertebral basilar artery and vein. And you can see this is the trigeminal nerve, and there is an arterial loop over here and that is causing some pressure on the trigeminal nerve, and this is how you can see we can have this patient of trigeminal neuralgia. And these are the watershed zones that are watershed locations are those water zones or regions in the brain that are supplied with the major cerebral arteries, where the blood supply is decreased between the territories of two major arteries. So this is the brain watershed area, and this causes the watershed strokes that are a concern because they comprise approximately, 10% of all the ischemic stroke cases. A watershed stroke or watershed cerebral infarction is defined as an ischemia that is localized to the border zones. So note that the actual bloodstream blockage restriction site can be located far away from the infarct. So you can oversee over here, this is the anterior cerebral artery zone and this is the middle cerebral artery zone. So this is the boundary. This is the boundary and this is the watershed area. And in fact, over here, can you appreciate this little hyperdensity over here? This is the impacted area. And similarly, between the PCA and the MCA junction, you can see over here, this is the watershed area. You can see there is an impact over here. So these are the watershed infarcts. Now coming toward the brainstem, which is the structure that connects the cerebrum of the brain to the spinal cord and the cerebellum, and it's composed of three sections in descending orders. You can see the uppermost part is the midbrain, the middle is the pons, and the lowermost is the medulla oblongata. So they're coming towards the midbrain. Midbrain contains the origin for the cranial nerves 3 and 6, that is the oculomotor and the abducens nerve. And as a part of brainstem, the overall midbrain function is to control sensory and motor pathways. So again, I think that you can now see these pictures on the right side is a very important diagrams I have taken from a paper. I showed you actually these were for the brainstem safe entry zones that were you can see they have been labeled over here, and we use certain zones in causing resection of interesting brainstem lesions to avoid minimal damage, you can say. So these are referred to as the safe entry zones, which have been labeled over here. But these images were amazing. I'm just going to give you just a very brief idea of the safe entry zones and how to identify them. So when you just look at this, the reticular formation is an important part since it is important for mapping the overall alertness and attention and for cardiovascular systemic control, respiratory regulation, and its relation to consciousness during the waking and sleeping cycles. And the red nucleus, which is a subpart to the reticular formation, it is found in the midbrain. It's important for motor control, specifically in coordinating the autonomic movements between swinging arms and the walking legs. And then the barrier-ductal gray area, that works to control pain. The substantia nigra, that is, you can see over here, if you go through, this is the midbrain section, and this is the cerebral aqueduct. You can see this is passing through it. And this is this substantia nigra, the dark colored area you can see over here, and here you can find the red nucleus. And I guess I thought I won't be going deeper, but I would like to here tell you about the safe entry zone. This is the ICR, this is the intercollicular regions, and this is the anterior mesencephalic zone you can see over here. So these are, I think that you should just remember that, because I don't think that I'm supposed to go any deeper, but these are some important zone. Again, this is also an important zone, the LMS, the lateral mesencephalic sulcus, that you can use for the safe entry into this midbrain. These are the safe entry zones. So, substantia nigra, it contains the dopamine producing neurons that aid in motor control alongside the basal ganglia, another brain structure. The action of this area are responsible for inhibiting the thalamic motor activity. This region degrades early in patients with Parkinson's disease. And the midbrain tectum, you can see the corpora quadrigemina, the superior and inferior colliculi, and can you see over here? These are these things. The corpora quadrigemina, the include the superior colliculus, which is affiliated with the visual reflex center, and the inferior, which is with the auditory relay center. So again, you can see over here is Muhammad Ali, who suffered from, Parkinson's disease, along with Michael J. Fox, who's also, struggling with Parkinson's disease. So again, they say that there is some affiliation with boxing and, repeated blows to the head that may lead to, Parkinson's. There's a connection between boxing and brain injury. Head blows from boxing can cause dementia and Alzheimer's. Can the same chronic brain injury also lead to Parkinson's disease? It is a question over here. Coming down towards the middle part, this is the pons. It is where the cranial nerve 5, 6, 7, and 8 originate. Most noteworthy rules include functions related to respective cranial nerves originating at the structure. These include recognizing sensation of the head and the facial areas, as well as the movement of the face, eyes, ears, and mouths. And furthermore, the pons is important for autonomic activities such as saliva production, and in addition to maintaining equilibrium. Similar to midbrain, the pons contain the part of reticular formation, and this accompanies functions in cardiovascular control and breathing rhythms. So again, you can see over here, this is the pons, and this is the basilar circus of the pons where the basilar artery lies. And can you appreciate, this is the fifth cranial nerve that is coming out from here. And again, middle longitudinal fasciculus, they have just denoted over here. And this is the 7th cranial nerve complex that is arising over here. I think you can see over here quite nicely, and that they have shown so many things over here. I will explain this rhomboid fossa in a separate lecture. Coming towards the medulla oblongata, medulla is the origin of the cranium 9, 10, 11, and 12. Asymmetry of the brain raised temperature is important for relying to standing motor control and sending sensory information. Specifically, however, the medulla is most notable for its control over the body vitals, including ensuring proper cardiovascular control and respiration. It is also noteworthy for stimulating many reflexes such as vomiting, coughing, and sneezing. Many functions of the medulla overlap with hypothalamus, where the medulla is often the structure in which the hypothalamus relays instructions. Additionally, the medulla is the origin of brain of 9, 10, 11, and 12. You can see over here, this is the medulla. These are the pyramids over here. Can you see them? This is the medial meniscus over here. This is the inferior olivary nucleus. This is the medial, again, this is the medial longitudinal the fasciculus over here. Can you see, this is in the turquoise color? This is the sensory nuclear crane of 5, and this is the nucleus of nucleus solitarius. These are the cochlear nuclei, the vestibular nuclei, the hypoglossal nuclei, the dorsal motor vagal nuclei, and you can see overhead the spinal nucleus of cranial 5. So you can see that it is coming overhead the pairs salivary nucleus and the nucleus ambiguous. So these are the structures that I think you need to know about, but this is a quite huge list that you should read.